notes or anything anywhere. Okay, so I've come in, I've washed my hands, I provided the patient with privacy by closing the door, and I've checked the chart for any notes. All right, so hi, my name is Tina, I'll be your student nurse for today. Can I have your first and last name?
Monty Johnson.
And your date of birth?
11/30/1997.
Okay, and what brings you in today?
I'm just coming for a physical.
Right, are you in any pain currently?
No.
All right, so do you know where you are currently?
Yes, the doctor's office.
And what's our president's name?
Donald Trump.
All right, so the patient is alert and oriented ×3. The patient is definitely dressed appropriate for the weather. Her hygiene is intact. She seems to know what's going on around her. Okay, so first we'll start by your skin. Do you have any problems with your skin?
Yeah, I suffer from dryness.
Okay, do you see a doctor for it?
No, I just use regular lotion.
All right, so do you have like a family history of the dry skin?
Not that I know of.
All right, so just by looking at the patient's skin, the skin does seem intact. There's no nodules, no pustules, no moles, no abrasions or no wounds. All right, so then we'll move on to the hair. The patient hair is kinky, curly, and it's soft to the touch. As far as your hair, have you noticed any thinning of the hair, falling out in clumps, or any bald spots?
No.
All right, so next I'm going to palpate your scalp or your skull, which means I'm just going to feel around for any masses or bumps or anything. Okay. So at any point, if you feel any tenderness, please let me know.
Okay.
Any pain here?
No.
Here?
No.
And how about here?
No.
All right, so feeling the patient's scalp and her skull. The skull is a normal size for her age. There are no bumps or no masses or lesions in the scalp. All right, so next we'll move down to your eyes. Do you have any problems with your eyes?
No.
Do you wear glasses?
Mm-mm.
Do you suffer from dry eye,
Mm-mm.
watery eye? And when is the last time you've been to an eye doctor?
A few months ago.
All right, so just looking at the patient's eyes, the scleras are nice and white. The conjunctiva is pink and clear. So the next thing I'm going to do, I'm going to shine a light to the side of your eye just to see how your eyes constrict. It's called direct and consensual direction of the eye. So I'm going to start coming in from the side. Okay, you want to look straight ahead. All right. Okay, so the eyes do constrict direct and consensual with light. So the next thing we're going to do something called a cardinal gaze, where I hold the object in front of you and you just follow with your eyes and your eyes only. Try not to move your head, okay? We'll use this pencil. So we'll start here. 1, try to only move your eyes. 2, 3, 4, 5, 6. Okay, so that was successful. There's no jerking or anything. The patient doesn't seem to struggle to do that. So the next thing we do, we're going to see if your eyes can accommodate. So I'll have you look straight ahead, and I'll place this object in between your eyes, and I'll tell you to. I want you to look directly at the object, okay? So you're looking straight ahead. Okay, so we focus on the object. All right, so the patient is able to accommodate. So the next thing we're going to do is we're going to feel around for your lymph nodes, so it's be more palpating in its various areas, okay? All right, so we'll start here with the pre-auricular, post-auricular. Can I have you drop down, turn to the side so you can see the occipital. All right, so I'll step behind you. And I have you lean over to this side. We're going to palpate the deep cervical. Okay, straighten out. Same with this side. Palpate the deep cervical. Any pain?
Nope.
All right, so you want to straighten out. So have you hunch your shoulders forward, and we'll palpate the supraclavicular area. All right, good. You want to straighten out. Then we'll palpate the posterior cervical area. All right. So all 10 lymph nodes seem fine. I didn't feel any nodules or bumps. So while I'm here, we'll test your neck and shoulder strength. So I'm going to push down on your shoulders, and I want you to try to push up to stop me, okay?
Okay.
Ready? Go. Okay. One more time. Okay. All right, next thing I want you to try to, I'm going to lean your head over, and I'm trying to push your head. You want to try to stop me from pushing, okay?
Okay.
Ready? Go. All right. Lean over. Okay. Pretty good. So next thing we're going to do, oh, I'm sorry, we go back. We got to palpate your thyroid. So I'm just going to place my fingers on both sides of your throat, and I'm just going to push one side and palpate here. Okay. Same thing on the other side, and palpate here. Okay, so everything feels fine. I didn't notice any bumps or anything protruding. So the next thing we're going to do, as far as your balance, I'm going to have you stand up, and I'm going to have you put your feet shoulder width apart as such. Put your arms out straight. Close your eyes and I want you to touch the tip of your nose with one finger. Ready? Okay. Next. Okay. Good. Balance intact. You can have a seat. And the next thing we're going to do is a whisper test. So I'm going to stand behind you again and I'll whisper on either side and you tell me which side and what word you heard me whisper.
Okay. Table, left, apple, right.
Okay. Pretty good. So the next thing we're going to do, we're going to assess your ears.
Okay.
All right. So do you have any trouble hearing? Any pain in your ears? Any ringing?
Nope.
Any dizziness? All right. So I'm going to pull your ear up and back just to look at the canal and shine the light in. So up and back. Any pain when I do that?
No.
All right. Ear canal looks good. Same thing on this side. Up and back. Ear canal looks good. All right. So we're going to do some more palpating, some more feeling. If anytime you feel any pain or pressure, let me know.
Okay.
Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
Okay. So pretty good. So next we're gonna examine your mouth. So do you have any problems with your mouth?
Nope.
Any dry mouth? Any pain? Do you have all of your teeth?
Yes.
All right. And have you had your tonsils removed?
Mhm.
All right. So I'm gonna shine a light in your mouth, and I want you to say ah.
Ah.
All right. So notice the rise drop of the uvula, and there are no tonsils present, and the hard and soft palate is pink and moist. The pharyngeal wall pink and moist. You want to stick your tongue out. All right, so the tongue is intact and midline. All right, so last thing we're going to inspect is your nose. Do you have any pain in your nose? Any surges in your nose?
Nope.
Drainage?
Nope.
Nosebleeds?
Mm-mm.
One more thing I forgot. We're going to palpate your sinuses.
Mhm.
All right, so when I touch here, do you tell me if you feel any pressure?
Okay. No.
Okay.
Nope.
Okay, going back to where we were. So as far as your nose, so you said no surgeries, no nosebleeds, no dry nose. Do you have a runny nose?
Mm-mm.
All right, so the nose does look symmetrical and the place is supposed to be any pain?
Nope.
All right, so I'm going to shine the light up your nose also.
Mhm.
All right. Nasal passages look pink and moist. No deviations. We'll do the same on this side, excuse me. No deviations. Okay, looks pretty good. So give me a second now. The doctor will be in shortly, okay?
All right. Thank you.
Thank you.